health has a very close relation with technology, innovation, and economic development. It's an important role in terms of rights, in terms of quality of life, but also when we think all the frontier technologies that we're dealing with and has changed the world in a very fast pace, they are either, some of them, few of them, sprung from the health field, such as genetic engineering or synthetic biology, or they have a very strong application development on the health field, such as AI, but many other technologies that are now our main references to think this changing world. And also, health has a very important role in terms of economic development. This aspect has been sometimes not duly dealt with, but when we think of all the areas of related to health, what we call the health industrial complex, this is responsible for about 10% of GDPs in the developed countries, and this is also true for Brazil. So when we are dealing with health, we have to think about these two connections. And this is what health becomes such an important matter when we think in terms of not only, as I said, 2030 agenda, but also in terms of climate. No? We will see in this round table, in this session, that we'll have very important experts bringing complementary contributions to these connections of health, technologies, international coalition, and so forth, but also in terms of how Africa is building resilience in this area, also in terms of bioeconomy, and also in terms of the ocean. But one thing that we have to keep in mind, when we are talking about health and all these connections, there is an even more general framework that is conditioning all what we are doing in our perspective of the future. And this has to do with questions related to the challenge of multilateralism, denialism, wars, and these basic trends that make so difficult for us, as it is in the case of the 2030 agenda, to move forward. Brazil is very much involved and committed to try to reinforce multilateralism. It has been, and it's interesting to see this move. No? Brazil was the head of the G20 and also BRICS, and South Africa also has now this role in terms of the G20. We have many connections, not only, of course, with South Africa, but the whole continent and worldwide. And we think that to be able to move forward, we have to tackle this in a very, very incisive and very committed way. This happened, for instance, in the last General Assembly of WHO, when multilateralism reaffirmed the importance of keep going and had a decision in terms of the preparedness, the coalition preparedness for pandemics and so forth. And the same happened with the HLPF. Against only the votes of United States and Israel, the HLPF approved the official document reinstating the importance of the 2030 agenda and questions related as gender, food safety, multilateralism, and so forth. So that's how we think health should be approached as a very important, I would say, attractor. It's been said many times that health is a sort of conditioning an indicator of progress and results of the 25th Agenda. Now we are also trying to still think in terms of what happened with the COVID pandemic. COVID pandemic was a major disruption, what some sociologists call a social total effect. And this major disruptions brought a lot of questions that some of them are being tackled and some of them are lagging behind. There was a phrase from the international science community that said something like that, we have to reset the question of science and technology and make it a public good. And Helen Sirleaf also, as a co-chair, one of the important initiatives related to WHO, said that if the COVID pandemic doesn't lead us to change things, what will? But this, few years later, we see many of these lessons being forgotten. So today is a very good opportunity to have this broad aspect of interrelations of health, and I thank you very much for your presence, of all the people who are following us by virtually, and I will call our speakers, and I will do this from the chair. Well, our first speaker will be Dr. Liv Franzen. Dr. Liv is a senior policy advisor of the European Policy Center, a medical doctor with PhDs in social policies and extensive experience in global public health and social policies worldwide, working with public and private sector in a wide range of themes such as social investment and social innovations, pensions, health, gender, and well-being worldwide. She was also one of the mentors and developers of the LIVE. Okay, and as I said,
thank you, Paulo. Thank you, Chair. Good afternoon, everybody. Okay, sorry. I was asked to talk about. Is this okay? Do you hear me? Or do I really need to? Or do I need to keep a mic? Is it okay or not? Yes. Okay. I've been asked to speak about health and climate nexus. I really think that climate change represents actually the greatest threat to global health for the moment. And I will shorten my presentation a little bit because I had a different kind of information about the timing. But I will first talk about the interconnection. Then I will talk why innovative technologies are really offering an unprecedented opportunity to address both challenges at the same time. And I will talk a little bit about some examples that I have already referred to. Some of them are already referred to in Belgium, in Brazil, in India. And I'm curious to see and report how the progress is being made. I think that's one of the things we should be monitoring also. And then I will say something about the need to rebuild coalitions in an increasingly challenging geopolitical world. So, first of all, the interconnection. Climate change impacts global health and health impacts climate. There are direct effects, heat-related and drought-related illnesses and mortality, for example, but also extreme weather events that we experience everywhere in the world for the moment. Fires and floods cause injuries and deaths, and respiratory issues from wildfires and air pollution, and a little bit allergies for me for the moment, but nothing to do with climate change, I think. Then there's also indirect effects, of course. For example, the vector-borne diseases expansion. I will come back to that, but for the moment we even have dengue in Paris, for example, and we have an extension of malaria in this region also. Food insecurity and malnutrition, mental health impact from displacement and eco-anxiety. I think some of you experience this drastically also in this region. But then also the accessibility of healthcare, for example, is endangered. With floods and heat waves and whatever, healthcare is very often not reachable anymore when they're most needed, in the regions that are most needed, and by the people that need them most. So there is a dual crisis, and we have an opportunity to tackle them together, and I think we should. WHO says there's 250,000 additional deaths annually caused by... I'm sorry, is there a problem?
No, it's a code.
Ah, okay, fine. Not for me, I guess.
Sorry, Lily, it's I'm not with my cell phone, and I asked a friend just tell me about the time, because
Okay.
there's nobody here to support.
No, fine, sorry, I thought there was some problem in the hearing.
Not by code.
Codes that I didn't understand.
Sorry.
Okay, there are 1 billion people lack of water, safe, clean water, not even drinking water, but clean water. And then people at risk are 4.6 billion, which is half of the population in the world. And the most vulnerable populations, of course, are children, elder, poor communities, and very often with the least attention given to them. Innovation. Innovation, why technology holds a key to some of the solutions for the moment. We can accelerate the response thanks to technologies, and I think we need to do more and better of that. We can do a better integrated approach. Climate change, environment, water, health, all is working in silos. And for the moment, with new technologies, we can, if we want, integrate this much better and go much faster also. And then we have a possibility for democratized access. Communities, rural communities, thanks to technologies, can access if we do a little bit of an effort. As I said, I will refer to a few examples briefly, and then I hope some of the examples will be also related later on in more in-depth discussions in the sessions that follow today and tomorrow. And some of them some people will be here also to clarify some of the examples. But climate change could worsen malaria. Southern Africa is already suffering a surge for the moment. And that is really related to warmer weather that makes the malaria season longer and speed up the cycle of mosquito life cycle. There's increased temperatures, enable greater geographic coverage. And then extreme heat, for example, people are not really necessarily interested to sleep under bed nets when it's very, very, very hot, and so on. This is simple things, but and floodwaters, receding floodwaters, very often are a pool for mosquitoes to breed and spread the malaria, even there where people are most vulnerable and very often don't access the needed help. The technologies that can help, there's a range of technologies. I just want to highlight two. There's a vaccine now. Finally, we have a vaccine for malaria. And we have, I think Fiocruz is doing that, sterilizing male mosquitoes. But I think Mozambique is also has a program for sterilizing mosquitoes with gamma rays so that they spread less and they're keeping numbers down. What is important also is the organization of the stocks of drugs and health and vaccines in the health centers when there is a flood, when there is an emergency. Emergency stock regulation is very important. The second example that I extensively talked about in India, and therefore I wanted to go back to that, but that's the air pollution. In the meantime, then last year we knew that the air pollution is linked to health and lung disease. In the meantime, we also know that it's strongly linked to dementia, which is also a very important problem worldwide, of course. For the moment, there are 6.7 million deaths in 2019 due to exposure to ambient household air pollution. And there's a Swiss organization that monitors this air pollution worldwide, but very often has not enough data. When I looked into this, they don't have enough data on Africa very often. And so we need to do better in the monitoring of all of this worldwide. But looking back at New Delhi, where we were last time with G-STIC, when you look at the data for the moment, it looks like there has been improvement. But the improvement seems to be mainly related to the weather conditions. There was more longer monsoon. Some policies, localized, have worked, and some dust control technologies, but really not at the level that is needed. Because actually, when you look at the small particular 2.5 levels for 2024, they have increased. So we are not on the right track, even in a country where, or in a city where there is amazing pollution, actually. So we do better. One thing that can be done easily and has already sometimes is to improve the air quality monitoring. There, smart sensors and AI-powered pollution tracking is work. There's a movement, Clarity Movement Network, that is doing that. But one study, and it's low-cost IoT air quality sensors deployed in urban centers and AI algorithms to predict pollution hotspots. But that has been used in London, for example, and it reduced 18% of hospitalizations of targeted interventions using hyperlocal data. So it is having a very important impact on health, actually, and could be very, very useful in a lot of other countries and not that expensive. Water is also, again, an amazing problem that has implications for health, of course, and much more than health, beyond health. Water scarcity and pollution with droughts and floods affect millions. Over 2 billion people live without safe drinking water for the moment. Also, I was quite amazed, I'm involved in I will come back to that later, but the climate impact, melting glaciers, intensified floods, droughts and landslides, threatening water availability for billions of people. But water scarcity and pollution is not only important for people and their health, but it's also important for agriculture and for energy, and indirectly, therefore, also has an impact on health. You know? So, in a way, there's for the moment a movement that asks or demands or recommends for countries to have integrated management, for countries to urge to adopt integrated water management to balance human, agriculture and environmental usage. One specific project that I have been involved with that is quite amazing, and I hope some of you will meet the people here that are doing this project, because they are small, they are called the African Foundation, African Potential Foundation, sorry, because the logo is not here. They are doing survey and real-time monitoring of water pollution in South Africa. And what they found is amazingly worrying, actually, because they found high pathogen load, the first number one here. Then they find also high heavy metals in the water. They find pharmaceutical metabolites. They find agricultural runoff, emerging contaminants, and industrial discharge, all in the same pot. I mean, you can imagine that some of that going into agriculture, going into water, people will really be producing risk for people itself. But it also potentially creates resistance with having antibiotics, TB, and whatever, and heavy metals in the water. So potentially this could really create outbreaks. Okay, I'm going to skip some, but I want to say something about local production, because there I think local production and procurement of pharmaceutical products is really, I think biodiversity showed the way there years ago. I'm glad now that Africa is finally also moving forward, but also again not fast enough. And I hope the partnership here between countries and biodiversity will help that even going faster. One of the G20 conclusions that I've seen in preparation is actually related to that, demanding fast-track Africa capacity for independent production of pharmaceutical products, which is, I think, very critical. Important for climate and important for health. Yes. But together with this, we also need to leverage the mandates for the organizations that work on procurement. Procurement cannot happen only in Europe or in America. Procurement should also be organized in Africa. I'm not going to talk about the 12 other examples, and I'm going to say maybe finalize the way forward. I think there's policy recommendations that could be made, should be made in financing. Financing is very much of a challenge for the moment. In health and climate, finance for both is going down. And what is increasing for the moment is financing for military. I mean, we have a problem here for both, and we need to act together here. So there's a range of policy priorities we can come back to. But I think we are really living in a crisis area. There's only 17%, we're not reaching the SDGs by 2030. Really, only 17% is on track, and we are 4 years away from 2030. So we need to do something faster, better. And confronting in the meantime a crisis of wars and wildfires and climate disasters and political turmoil that Paulo already referred to. And despite the 2015 Paris Accord, global carbon emissions have steadily increased still. And health is not improving anymore because global health has been really attacked very strongly financially. So to finalize, I think beyond technologies, beyond the science and technologies and information, we need to really, the moment has come to mobilize. And we need to mobilize across the communities, mobilizing for health and climate, and working together to attack these converging crises and organize, innovate, and act with new methods involved in collective power. Thank you.
Thanks a lot, Lee, for this very comprehensive presentation. I think she brought very important points when she says about strengthening coalitions, but also accelerating, integrating, which many times is seen as contradictory of democratization. But for us, and Lee brought this to us, democratization is essential to make this effective. And also, she brought a very important question related to the effects of climate change on health. But one point that she brought, and it's the local production. I just wanted to add that Fiocruz will have a bilateral meeting with Tulane from CSIR, and one of the topics is to try to develop a joint initiative from Fiocruz and CSIR in this area. And then it will be moved to Cape Town, and we will have also a meeting with an important lab in Cape Town, which is now having work in the development of diagnostics. So we'll be trying to reach even more this cooperation that Brazil has with South Africa and actually the whole continent. We will be having shortly a office in Addis Ababa to work with the whole continent as part of our connections worldwide. So thanks a lot, and we'll be moving to a follow-up, very interesting also, and has some connection with what we said about democratization, because Nuno will talk to us about the role and highlights of G-STIC, we'll talk about this, community development and agency in the urban context of Africa. Nuno is a career diplomat and executive director of the UN Regional Technical Center for Disaster Risk Management, Sustainability and Urban Resilience, the G-STIC, Southern Africa. He is an architect and urban planner, graduated from the State University of Londrina, Paraná, Brazil. So he has close contacts with us in Brazil. In 2017, he was selected as Executive Director of FAM, Foundation for the Improvement of Business Environment in Mozambique. Thanks a lot.
It's a pleasure to be here with you all. Thank you, Fiocruz, for the invitation. We will try to bring a different perspective when we speak about health, especially because when we look health, we normally look the practitioners of health, but it involves a lot more. And we work with resilience, climate change, adaptation, and sustainability in the urban resilience factor. So it's a little bit different for us to include, but it's directly linked. So we would like to focus on community inclusion. At the end of the day, what we think is that everything is achievable, everything is possible if we include community on the basis of our programs when we are designing the programs. So I'll start by presenting DIMSUR. DIMSUR is an institution that was raised and created because 4 countries asked the help of the UN because they have the same problems since 2020 plus minus. They are affected by the same climate events. And because of that, they approached the UN asking for a solution, and the UN created DIMSUR, which is a disaster risk management center that is totally autonomous, apolitical, and it's not managed by the UN. So it's a totally autonomous. It's important to say this when we're speaking about democratization of things. My name is Nuno. I'm the executive director in office since 2022, and as Dr. Paulo was saying, I'm product from a Brazilian institution as a university student. So the mandate of ourselves was to bring this technical assistance and bring the more expertise, not only for governments and practitioners, but also to communities. We try to promote the knowledge of everyone, because at the end of the day, if you are just worried with governments, you know that everyone from the government, at the end of the day, you take off your tie, and also you are part of the community. So we decided that it's not only for the top levels, but also to the basis. And what we discovered is that these communities are responsible for the success of the projects that we do. One very important thing is the thing here, it's our two last objectives in this slide, which is the creation of networks and partnerships. It's the only way to promote this sustainability that we are talking about, and better knowledge management to not duplicate efforts. This occurs very much within African governments. We duplicate a lot of actions, which means expending double, triple the money with the same action. So we focus with three main pillars. One is bring capacity within a participatory planning tool, bring capacity to communities. The second one is the creation of or helping governments to the creation of policies or changing policies in order to improve this governmental technical capacity. And the third one, which is key, it's creation of a repository of information that makes available all the information that or we create or we gain in our projects or that we collect from our partners to make public the results for their projects. Because everybody's producing knowledge, everybody's producing data, everybody's producing information, but we are retaining information within ourselves, or this information must be paid. So when we close the day, we don't have access to very key information that would highlight and help us to make a broader access to the solutions, to the real solutions. I'm going to skip this one. It's a presentation of the team. We've got a very broad team. We are now responsible for Mozambique, Malawi, Comoros, and Madagascar, but we are based in Southern Africa, in Maputo, and within the SADC region. So there are 16 countries in the SADC region. 4 are with us already. We are trying to convince the others, but it's a back-to-back work, and within the diplomatic agenda, it's a work that we believe it's going to take a little bit more time for everybody to see the advantage of being part of a center like this. We believe that international partnerships is key. Academia, participation of academia, it's totally relevant, and the countries of SADC must have the same and common language about disaster risk management and sustainability for we to get only one phrase about the solutions we want to highlight. And the question is, what is the relationship between environmental degradation, climate change, and health? Because I think this is what we're doing here. We're talking about health. And for us, it's simple. Environmental degradation, worse climate change. We are speaking about industrial production. We are speaking about expanding it, but we have countries that don't produce nothing. And we are speaking also about how we decarbonize things. So countries like Mozambique, for example, is an example that I can bring, which is my own country. We don't have a big industrial production, but we also don't sell the carbon credits to a country that should be gaining this possibility. The second one is that climate change amplifies and multiplies this degradation, because by the time that it's already a problem, it only can be multiplied if it's already started with environmental degradation. And to finish, the both together affect directly health. This is harm human health through a diversity of diseases, malnutrition, the infections, and also disaster-related injuries that we see, especially in Southern Africa, that we cannot control the amounts of these injuries, and we are multiplying the scale and the effects since 2020. We don't sort the problems, and we keep on putting on top more and more and more problems. We still have problems that we have from 2020 flooding events in Mozambique, for example, that we are keep on resolving and not having the solutions yet. So if we do smart partnerships, promote global interaction within the diplomatic agendas and bring the technical capacity that all these agendas allow us with funding and technical expertise, I think we can promote autonomous management. And this is exactly what we want to talk about, is autonomous management, institutions that can bring knowledge, not, I wouldn't say for free, but in a way that the countries can achieve. In the plenary session, opening session, I was listening to the speakers, and they were saying that G-STIC is in Africa for the first time. Okay, this I think everybody knows. But more than that, we have to highlight that technology alone will not sort the problem. So this is why for ourselves, bringing the community, it's the only way that we can guarantee the success and sustainability of the programs that we execute. So it's not about technology, it's about people. In 2030, studies from the UN, especially from the UN Habitat, says that we're going to have the majority amount of the populations living in cities. It's going to be more than 50%. This is a highlight, and we have to, if we are speaking about the 2030 agenda, this is something that we have to keep in mind. Cities will not grow in the same way that this exodus will happen. So it's not possible. It's definitely not possible. We have a problem of the spreading of disaster risk reduction and management culture. We have a problem of resources, so how to engage and how to motivate donors to bring us resources. We have limited information and capacity within our governments and communities. We have a very, very, very small amount of our state budget directly to innovation technologies, and we are, as I previously said, overlapping institutional mandates, so we are spending 2 times, 3 times the same money for the same thing, and we have weak intersectorial coordination. And when I say we, I'm speaking about, because G-STIC is for the first time in Africa, I'm speaking about our continent. So this happens in some countries more, other countries less, but this is a cross-cutting issue. It happens all over our continent. So this should be things that we should look at. Air pollution, unsafe water, food insecurity, and damaged infrastructures, this can be some of the highlights that an institution like DIMSUR look and brings here for your thoughts, specifically because when you put these thoughts, you put community in front, and it's a total disaster. We developed with UN Habitat a participatory planning tool, and this is the tool that helps us in 2 things that we think is key for sustainability. The participatory planning tool allows us, 1, for the communities to highlight themselves their own problems, and second one, for them to choose their own solutions, but with a factor that is prioritization. You must prioritize your solutions. You will never have enough money to do everything you want to do. So first you participate. There is a very known phrase from Samora Machel in Mozambique that says that if you don't participate, you should engage with the decisions of the ones that participated. So we should participate first, and then you prioritize your solutions. I spoke about it. Bring communities to participate in the project proposals. So they are helping to write the proposals. And the inclusion of stakeholders brings us to a point which is the valorization of indigenous knowledge in the same way or in a critical way within the scientific knowledge. It's very, very important, this validation. Indigenous knowledge is key for a good solutions. So what we think, just to end, it's not about energy, it's not about money, it's not about information, it's about people. It's about including people, especially the beneficiaries. Thank you very much.
Yes, it's about people, and we have a strong adherence to what the talks of Nuno. Actually, Fiocruz, one of the questions that deals a lot is this connection between territories, communities, and how they participate in the co-development, co-production, and also the co-management and governance of our initiatives. I also bring attention that we will have tomorrow at 2 p.m. a special side event which will be related to also community agency in terms of risk management and health. And this will be, we have different people who will be participating, but also Fernando Carneiro, who is here from Fiocruz, will bring a very interesting experience, which is, we call popular health vigilance, which has been very promising. The development of the WHO is now integrated in the health ministry of Brazil as part of the official vigilance of our country. And also, I thought it was very interesting the way he brought this idea of smart partnerships. Not only having global connection, but also bringing the question, which sometimes from a very backward perspective of nationalism, people say that the globalization, the global cooperation is contradictory with the national development and nationality. This is a blunt mistake, and we are seeing, and this is very important, how the question of autonomous, which was stressed by the Minister of Science and Technology of South Africa in his speech this morning, is very important, that mingles with the technical, productive, and innovative sovereignty of countries in a way that the democratic participation is part of this global effort. So I think it was very interesting what you brought. No? And now we'll be following in an area which is very important. I will have Dr. Rachel Chikwanda. She holds the position of CSIR Group Executive for Advanced Chemistry and Life Science Division, and collaborates closely with academia as well as the public and private sector partners, both locally and internationally, to foster innovation that contributes to enhancing sectorial competitiveness and economic performance. She'll bring the questions of bioeconomy, global health, and sustainable development, with a special focus on South Africa and the role of CSIR. I just noticed it, and I was waiting for you to have this speech, because in the morning you mentioned bioeconomy, but you didn't mention health. You know, and I was thinking how CSIR is incorporated, because of course health is one of the areas in where bioeconomy is so strong. So I'm ready to listen to you.
So I chose the topic of growing bioeconomies to address global health and sustainable development, because I think there's an economic case to be made around health. If it is not economically sensible to do, it will not have significant socio-economic impact. And for me, I chose the topic on the basis of some of the enduring lessons that we were left with following the COVID pandemic, and also then going into an era of climate change, climate crisis, where in fact we anticipate more health crises to be upon us and for which we should be better prepared. So to that end, if I can move the slides forward, somehow, maybe? Anybody? I almost got it.
No, backwards. Yeah.
Okay. I chose to frame the conversation around the Sustainable Development Goals that have got an impact on health, but are also impacted by climate change and can be addressed through the bioeconomy. Looking at, Sustainable Development Goal 1, where we speak about no poverty, and we believe that inclusive bioeconomies can address poverty and inequality. And when we do that, we can improve access to health. Sustainable and tech-driven circular economies are important for zero hunger, and food and nutrition are vitally important for good health. Looking at good health and well-being itself, which is the direct SDG on health, where IKS biotechnologies can help us to prevent diagnosis disease. There's many more. Water sanitation have got a bearing on waterborne pathogens, and there is something that we can do in the bioeconomy around this. In circular bioeconomies, sustainable food, bio-based products, innovation are critical to sustainable cities. One of my colleagues spoke earlier about the impending migration to cities, where cities ought now to be sustainable and be able to be economically viable to sustain the populations that are flooding in. And of course, I want to end my talk with a call to action. So the global bioeconomy is interesting. It has a huge opportunity. Where we have right now a bioeconomy valued at about $4 trillion, with projections suggesting that it could grow to about 30 trillion by 2050. So there is an economic opportunity here that we can seize to address our health challenges in the context of a changing global climate crisis. But there is challenges as well. And the challenges are the uneven growth of the bioeconomy, the unevenness when you look at the north-south divide, and the unevenness that you also experience within regions. And these are brought about by low levels of investment into R&D, the challenges of scale-up infrastructure, the high costs associated with scaling up technology, and the scarcity of specialized skills. And I wanted to share the South African experience as it relates to health. And South Africa as a country has got an emerging, very strongly emerging bioeconomy, currently contributing about 8.3% to the South African economy, to the South African GDP. We believe that there is scope to do a lot more. This 8.3% has been brought about, it might look small, but it's been brought about by a very deliberate series of policies to drive the bioeconomy, starting with the white paper on science, technology, and innovation 30 years ago, upon the founding of the Democratic Initiative, the National Biotechnology Strategy in around the early 2000s, a 10-year innovation plan which really focused on valorization of indigenous knowledge, looking at the farmer to farmer grand challenge is one of those initiatives. The bioeconomy strategy in 2018, where we now sought to consolidate our experience, expertise, and competitive advantages to create world-class biotechnology system of innovation. And currently now, this science, technology, and innovation decadal plan, which we colloquially refer to just as the decadal plan. So all this was aimed at driving the bioeconomy locally. So in the context of that, CSIR has been a major player. And who are we? We are a public research institution, and suffice it to say, we are Africa's largest multidisciplinary research and technology organization, mandated with directed research and technological innovation to drive industrial development on the one hand, but paramount to us is that social impact. where we connect with communities to seek to find meaning to the innovations that we run. We sit in that space in our innovation ecosystem, where you have very strong tertiary higher education institutions. Universities in South Africa are very strong innovators. And industry is also quite strong. But in between that strong innovation and industry and service provision is a gap that we call the innovation chasm, where we need to translate that knowledge into high-value solutions and impactful solutions for that matter. And it is in that chasm that we sit as we seek to translate knowledge into products and services. Now, in the space of health, in the context of the challenges that we face now, we have fashioned ourselves to deal with surveillance, where we look at wastewater-based epidemiological tools. We developed this at the advent of COVID-19, and we're continuing to mature this so that we can deal with new emerging pathogens of concern as climate begins to change, continues to change. Diagnostic capabilities, tools, reagents, and services is something that we work on. Medical diagnostics and devices, assembling everything and also making reagents. Vaccines, treatments, and therapeutics is a space in which we play. And then infrastructure systems and decision support, especially in the context of disaster management. So that's something that we hope we can have in collaboration with some of the parties sitting on the panel. I want to focus my talk on the research, development, and innovation that we do to prime the bioeconomy around diagnostics, medical devices, vaccines, treatments, and therapeutics. Very quickly. And the CSIR really in its response, it's been a long-term response, but it is one that has really been emphasized and honed by the challenge of the vulnerability we felt during COVID-19 when we were left at the mercy of those that had to then wait in line to receive diagnostic reagents, to receive vaccines, to receive therapies for those that were already sick, to receive ventilators. We learned some hard lessons, and the gap that we realized left us in that space of vulnerability was the gap of needing translational capabilities to enable scale up of the good science that's coming out of our universities, to enable local businesses that will drive the making of these diagnostics, reagents, therapeutics, and so on and so forth locally. And so what we then chose to do was to build infrastructure, focus on skills development to strengthen these translational capabilities. So that was the niche we chose to occupy. And in this regard, we built our capabilities from the bottom, leveraging the parliamentary grants that we get, to build our foundational capabilities, leveraging more funding from contract work from government, catalytic funding from philanthropic and other organizations. Once we set those base capabilities, we then realized we could have conversations with the private sector to really build on this. And I'm told I'm left with 5 minutes, which is now mission impossible. But at the gaps that we have in the diagnostic value chains, from everything from supply chain challenges, the import costs, high costs of R&D, challenges of regulation, and so on and so forth. And we decided that we were going to meet that gap of helping innovators in our country and on our continent to build those prototypes and carry them through clinical validation so that we support a local industry that can make functional, approved diagnostics. We created a diagnostic hub in collaboration with universities where we make everything from reagents to fully assembled devices. We have some examples here of some of the devices that we've made. We created a company to make COVID-19 reagents in the heat of the moment. We made ventilators, 20,000 of them locally, also in the heat of COVID, among many other things. that we can do. With the vaccines and therapeutics, again, we looked at where the gap is at, and in our country, it is that gap where we find lead molecules, potential candidates needing to be taken through clinical development. And there, we developed capabilities that allow us to make, whether it's small molecules or biologic molecules, really taking those and packaging them and making capabilities that allow development of clinical quality materials. This is a vignette of some of the infrastructure that we use. We use the same infrastructure of the basic research to toll manufacturing, where we support new entrants in industry to actually make products that go into the market via the clinic if needs be. And we can train a workforce of capable workers in these biomanufacturing facilities. And this is our CGMP facility, which is an open access facility for this purpose, where we intend to collaborate with others to strengthen our ability to be independent. And these facilities are not just for the CSIR to play in research and development. These facilities are to prime a bioeconomy. All the new entrants in South Africa and on the continent can find access to these facilities to enable us to build an African industry, driving a bona fide African innovation agenda to meet African requirements. I want to end my talk with a call to action. And this call to action includes, can we collaborate more on some of these models, building them further, so that we address the disparities in science, technology, and innovation to drive bioeconomies between North and South and within the region? Can we leverage centers of excellence as technology transfer hubs? We're offering the CSIR as such, and we hope our colleagues from Theocris could offer themselves as such, because we visited them and they are extremely strong. Can we have knowledge exchange dialogues that allow us to do this? I want to leave my presentation here, encouraging some of the things that we want to do with G-STIC partners. How do we get Big Pharma to help us to do better in innovation and R&D? How do they invest more in local R&D? How can our governments help us to really strengthen our own industry by giving us opportunity to sell our product, which may not be as competitive as products from India and China, into the local market because they are huge buyers? How can we encourage deliberate investments into infrastructure? And what are those models that we can share? Those are the things that I would like to believe that the G-STIC community and partners in this room could collaborate to bring resilience into our healthcare systems in the context of a changing climate and intensifying health crisis. Thank you.
No, it's not nice to get moderated and having to keep control of the time, but it's necessary. We could see from Rachel's presentation how strong the commitment of South Africa is to bioeconomy, and this is one of the mission themes that is being discussed in a major agenda of G20, of Brazil in the COP30. So this is something that the contribution of South Africa makes much relevant. But also, I think she brought the question of social impact. In this sense, I think one of the questions that we are addressing is how, since bioeconomy has a lot to do with nature processes also, and how this will benefit the rise and participation in the results from the traditional people, the people from agriculture, and so forth. Right? And so this is something that is important in the agenda. And it's also enforcing what we brought in terms of local production, and Fipus will be very much willing to cooperate with South Africa and CSIR. The last thing I would like to bring attention is that bioeconomy is very much related also to the ocean. And we have here José Moutinho, and he's one of the leaders of a very important project, Ocean Quest, in which he has a deep mountains exploration and doing a worldwide effort to have funds and have a program for developing this in terms of, and we included and we are part of this. There's the question of the bioeconomy, introspection, and William from Fiocruz is here, one of the leaders of this initiative from Fiocruz. So we'll move now to the ocean, but in a broader perspective. We'll have our colleague and friend, Alexander Tuba. He is chair of the Ocean Sustainability and professor at the University of São Paulo. The Ocean Sustainability is a UNESCO chair, and brings a pioneering vision of Blue One Health, integrate marine ecosystems into the One Health framework and linking ocean resilience to public health and well-being. Tuha was also one of the leaders of the O20, which was the major area that was presented and discussed during the G20 meeting that took place in Brazil.
Hi all, can you hear me? Are you ready for the ocean? I know that you are ready for the lunch. Make sure to look a little bit and you'll be there soon. So I'm excited to talk in this session. Thank you, Paulo, for the invitation, and thank you for this amazing meeting in relation to the SDGs, in relation to the sustainability agenda, and also to how to innovate and create solutions to solve the problems, the real problems that we are facing. And the ocean is there. I used to say that the ocean is everywhere. Isn't it? It's here. You are sitting on the ocean. We are using the ocean. The ocean is everywhere. We are eating the ocean outside probably.
The ocean is everywhere.
Yeah, the air, everything. Okay, I'm excited about the ocean, but we need to understand that as we were discussing here the importance of connection, the ocean is connecting a lot of things. I'm making teleconnections through the air, because of the water that we are drinking, that was before the ocean and so on. So, the ocean is important. The ocean is important for the economy, for investments. We are talking about bioeconomy. We have bioeconomy from the bottom of the sea. The ocean is important to combat poverty and to promote food security. The ocean is important for health in different ways. There was a publication last year based on pictures of a very important hospital in São Paulo city. The name is Albert Einstein Hospital. There is a link with the university. And they have a collection of pictures that are used to promote feelings in the people that are being treated. So they have pictures of puppies, of forests, of dogs, and of the ocean, several types of pictures. And they did an experiment and showed that the pictures that have the most impact on people, feelings, good feelings, is the ocean. No, true, I can share the paper, it's true. And then we need to recognize this importance, because not everyone understands that. That's why ocean literacy is so important, not only for scientists, but also to society and decision makers. We also need to inform strongly that the health that is being provided by the ocean in this context, in this big context of Blue One Health, because we cannot detach the ocean from this discussion. The ocean is being threatened. And it's losing the capacity to fulfill this role. It's a kind of benefit that ocean brings to people, to us. So we are talking about planetary crisis, climate crisis, biodiversity crisis, pollution crisis, poverty crisis, and also about planetary boundaries that are being crossed. We have crossed 6 out of 9 boundaries up to now. And with these threats, we are losing the important capacity of the ocean to provide these benefits, as I said. When we pollute the ocean, we are creating comorbidities. We learned this word in the COVID. And this makes us understand that if the ocean has high blood pressure or diabetes, we can translate it to different things. If we have heating, if you are heating the ocean, we are polluting the ocean, it's losing its capacity to function. As us, our homeostasis, we have the planetary homeostasis, and then we are losing the way, the capacity to control our conditions and provide conditions or benefits to society. So it's important, and one of the key messages I would like to deliver is ocean health is human health, isn't it? Okay? So it's important. And the ocean is a strong, a central agent to promote sustainability. Planetary. So this is important. And then SDG 14, which deals with the ocean, should be strategically supported. But it's not. It's the least funded and the least that is being developed. It's the last one. We are failing to implement SDG 14, life below water. So we have big problems in front of us. This recognition of the ocean is not so bad today. It's increasing along history. There's a long timeline starting after the Second World War, and especially in the 60s because of the whale hunting, because of oil spills and nuclear waste being deployed in the sea. And then in the 70s with the Stockholm Convention that started to talk about the ocean very slightly. But in the 90s we had the Rio 92. And there we had Agenda 21 with 40 chapters. Remember that? 40 chapters, one dedicated to the ocean. One out of 40. And then we started to have the ocean more commonly in the multilateral discussions, including Rio Plus 10 that was held here in South Africa, where we started to understand what kind of information we had from the ocean worldwide. We had the assessment of assessments linked to the Millennium Assessment, as a follow-up of the Millennium Assessment, to show us that we need a structured way to look at the ocean. And then UN created a regular process to assess the quality of the ocean, including socio-economic aspects. And then blue economy started to be born. 2002 and 2012. In 2012, we had Rio Plus 20 in Rio de Janeiro again, and then we started the momentum that created the Agenda 2030, especially SDG 14. So it's important to capture this idea because in these arenas, in these important arenas, we have the opportunity, if the decision makers are sensibilized about the role of the ocean, to take important decisions about that. And now, within the ocean decade, the decade of UN Decade for Ocean Science for Sustainable Development, from 2021 to 2030, we have the opportunity to put science and the ocean in the agenda again. With conferences of the United Nations dedicated to the ocean, we had 3 In New York, 2017, in Lisbon, 2022, and this year in Nice, France, we had the opportunity to see a kind of process where we started to understand the problem, we engaged it with each other, and now we are focusing on actions. And this brings us to the panel today. Actions. We are talking about actions. We are talking about solutions. Solutions created by everybody together. Solutions that are meaningful. Solutions that will change what matters. What matters for people, not for some. Huh? And then we need to mention two processes. As Paulo said, G20 last year in Brazil was perhaps the year when ocean entered the agenda to forever, I hope. At least this year, South Africa kept the group of engagement of civil society dedicated to the ocean. And we, as two countries in the presidency of G20, we are trying to promote the ocean. Next country will be US, and then we will see what will happen. But it's important that G20 considers the ocean as an important aspect in their health and wealth. Because without the ocean, most of the G20 countries would not be G20 in the past and in the present. Think about South Africa, think about Brazil, US, Italy. And COP30. COP30 will be held in Brazil in November, and this will be the Ocean COP. The Ocean COP because we are strongly pushing to have the nexus between ocean and climate strongly mentioned in the final declaration, in the final documents of COP. Because the nexus between ocean and climate is vital for mitigation and adaptation measures, and we need to incorporate. And this means health, and this means economy, and this means people participation, and this means a very important way to move forward. Thinking about the future, we need to stress to strengthen the systematic thinking, and it cannot be done without the ocean. So I'm trying to promote the ocean. But it's true, you know, it's impossible to separate. We need to strongly support science for sustainability. Science that is strongly linked to these important goals that we created as society, as humankind. So we need to support the ocean decade and bring the ocean decade to help us. We need to support, for example, the international platform for ocean sustainability, which is being created by several institutions, including a South African one, conducted by dengue. And in Brazil, we are trying to push this type of science with a program created in the São Paulo Research Council, named PROASA, which is a program for the South Atlantic and Antarctica. We need to build trust. We, in the South Atlantic, we have a very powerful tool to promote trust and peace, which is the ZOPACAS, the Zone of Cooperation and Peace of the South Atlantic. And this is really important because this deals with science, with health, wealth, economy, and other things. Now it's a place where we don't have wars, we don't have piracy, and we don't have nuclear waste, and where we can have a sanctuary of whales soon, which will be very important to implement the BBNJ treaty, the treaty regarding the biodiversity beyond national jurisdictions. So it's important that we use this huge amount of water that connects Brazil, for example, and South Africa, or South America and Africa, in a way that we can advance together. So we need action. And this also means that we need to use the existing tools to do that. So I strongly suggest that we engage the Ocean Decade. We have 5 years left to end the Ocean Decade, and it will end at the same date that the Agenda 2030. So we will add SDG 14 and the ocean decade. And then we need to think about what comes next. What's the agenda post 2030? How are we going to build it? If we're not going to implement the Agenda 2030 as we demonstrated. So it's important that we engage the ocean decade. It's important that we strengthen the relationship between ocean and society. What is the role of the ocean? The UNESCO Chair for Ocean Sustainability that I'm leading in Brazil, the idea to connect, to show people the importance of the ocean, and to change the reality based on what the ocean can afford us and give us. In the end, I would like to say that for the ocean, it's not enough to be blue. It should be sustainable. And what does it mean? It means that we need to have a better relationship with the ocean and the people that depends directly and indirectly of the ocean. And to do that, we need to promote ocean literacy and put the ocean in our minds, our heart, and our souls. Because it's important and because it's urgent. And we need to do that now and in the future. So join us in this endeavor to promote the ocean and to strengthen and to evidence the links between the ocean and the very important things, lots of important things that we have that are relevant to our lives and to the global sustainability. So now we can have lunch. Thank you very much.
Thanks to her. He's done a lot in terms of the ocean questions itself. And I also remind that we had this year the UNOC 3, huh?
Yeah, we had in this.
Yes, yeah. We had, and I was impressed with the powerful presence and the discussion that happened there. So the UN has this as an important, but as Tuha said, there are so many hurdles. As part of the National Commission on SDGs in Brazil, I participated in the National Voluntary Reports to the UN. And one of the things that we were dealing with SDGs related to ocean is that there was very little information and monitoring indicators to do the report. So data processing and so forth is very important. And and this is keeps moving. And Tuha brought us a question of the future of the 23rd agenda. This is something that will be started officially in 2027 by the UN, no discussion, but actually is already taking place and getting forward. We always think that the 23rd agenda is the most important and comprehensive reference that we have worldwide, and it will stand not only because of the SDGs, independently on the success and results that we achieved, but because it was for the first time it brought the connections between economy, environment, and society, and also did this in a way that brought the main themes that affect the future of humanity and the quality of life of people, countries, and populations. So we think it will be moving. Probably the new data for a reference will be 2050. The principles, the multilateral process that brought to the agenda that shall remain and will be, and will have to be strengthened. We'll have the chance to have deep dives on these themes that we have today. Tomorrow, I mentioned already, the question of community agency, but also we will have a deep dive on blue, on health, and also a deep dive on climate and health. And this deep dive on climate health will be coordinated by Luis Paulo Assad, who is here also from the Brazilian delegation, who belongs to a very important Brazilian institution, COP, who does image of the earth, geoprocessing, and many works very relevant in terms of the oceans and also the connection between this and blue and health. So I invite you to be there. This afternoon, we'll have also a plenary session on climate change as a whole. I think it's a good opportunity to keep discussing this. I won't have the possibility, because I talk too much, to ask questions to the speakers, not open to the audience, because our time is up. But I will ask each one of you, you have some final comments and perhaps build on some of the questions we brought. Please be short. I will start with Lee, and then I'll follow the sequence. Nuno, Rachel, and Tuba. And I'm saying already, thank you very much. I think this was a fantastic session. I see many people stay up to the end, which is a good sign. And I think that we'll have very important developments on this discussion in the STIC, but also in other forums.
I'm sorry that we cannot have the audience commenting and questioning, but okay, I think I would like to highlight that the partnerships between the different partners with G-STIC is still a very valuable model. But I think we should go beyond going from meeting to meeting and build also momentum in between meetings. Monitor actually progress in some key areas. Because I understand that the 2030 agenda will go on, but I think we really need more urgency and acceleration. And therefore, I come back to my last slide. We need activism from different areas working together. There's one mention I mentioned one project on water. If anybody is interested further to discuss this, the people dealing with this project here in South Africa are in the room. So please contact me.
Thanks, Lee. Just one information. We have co-host meetings of G-STIC. There is already a plan to change the nature of G-STIC, which is now more directed to events, not only here, the every event, but at the UN and other places. We will have in Brazil now a side event of the Belgian government in Brazil on bioeconomy. I think Rachel will be there. But the idea is to transform G-STIC in a permanent action in terms of this mission of taking SDGs for sustainable development. And this perhaps will be done having a new juridical nature, status for G-STIC. We'll be discussing this during G-STIC now, and probably it's about a 12-month work that we'll be able to present the proposal to you all. Okay?
Thank you very much. I think that this is a point in now, a potential inflection point for us to take the conversations into actions. The world has got a lot of tools in terms of technology, and it has got a lot of actors. But I think what we need to do now is to consolidate the actors in some focused actions. I really am excited about the possibility of transforming G-STIC into a permanent action, moving beyond the meetings into some tangible, collaborative activities where we share experiences and demonstrate what is possible for the cause that we try to drive towards meeting the SDGs, towards health and well-being for all. So I'm excited at the inflection point that we could make this become.
Thank you. I would like to make two final comments. The first one is related to the African countries that are in this room. I would like to invite them to participate in institutions like this. We have to engage in the solutions that we want to see in this highlighted future. So we are specifically in a region with 16 countries, and we don't understand why you don't have to pay a fee until now. We don't understand how diplomatic institutions that brings technical capacity and funds are not being approached from the African countries. The second one is we would like to highlight the fact of the COP30 being in Brazil. It's a key event. It's a very, very, very key event with a lot of constraints. But I think it's a key event. You should participate if you have the possibility, because I think there are coming very big decisions about sustainability, urban resilience, and climate change adaptation. Thank you.
Well, the COP30 will be symbolic because it's the only place in the world that you can connect the blue and the green Amazons. We have the green one, but we also have the blue one. And we need to understand a little bit more. I would like to finalize saying that the ocean decade was created to help implement SDG 14, which is so central and transversal to the sustainability agenda worldwide. So please be informed about the ocean decade, engage in the ocean decade, and if possible, attend the Ocean Decade Conference in Rio in April 2027, because this will be the moment to have the final steps to see the transformation happening. So don't lose this opportunity, because that's the moment to make history.
Well, thanks a lot. We started later, but I think we did the possibility of having fantastic presentations. Sorry again for not open to the audience, and thanks a lot for your presence, also the people who followed us virtually. Thank you.